Let's get to our first panel, and I will let our moderator introduce our panelists, but I'll introduce our moderator. He's also the co-chairman of this entire day, Judge Raymond Abramson of Hollygrove. He is fourth generation from Hollygrove, received his undergraduate degree from the University of Virginia in 1973, and then his law degree from the University of Arkansas at Fayetteville in 1976, and he came home to the Delta. Practiced law in Clarendon for 34 years. He was the Monroe County Public Defender, Clarendon Municipal Court Judge, Hollygrove Police Court Judge, Hollygrove City Attorney. Judge Abramson also served as a special justice on the Arkansas Supreme Court on 5 different cases. Governor Mike Beebe appointed him to the Arkansas Court of Appeals in August of 2010. He was then elected to the Court of Appeals for an 8-year term that began on January 1st, 2015. Back last summer, Raymond and his wife Maki invited me to their beautiful old family home. In fact, there are a couple of state record trees in the backyard of that home in Hollygrove, and we had a wonderful evening there eating catfish and talking about the Delta. And again, it was out of that stay that this conference and this idea grew, and then we hooked up with Riddler Arnold the next day, and then I came back here to George Macris, and Simmons got on board. So this is really one of the founders of this conference, a man whose entire life has been devoted to improving life in the Arkansas Delta, Judge Raymond Abramson. Judge?
Thank you, Rex. That's a too kind introduction. Can everyone hear me? No? Okay. I'll get closer. How's that? Is that better? I'm not as tall as Rex. Well, it's a pleasure to be here today. This is a wonderful occasion. It's great to see all of you out there. I have so many friends here today, and we've been working very hard to bring this day to fruition, and I want to thank Rex and Tabitha and Simmons Bank and all of the sponsors for making this happen today. This has been the germ of the idea has been in the ground for several months. I guess we started talking about this last summer, and strangely, we decided to pick a day far enough away in April so that there wouldn't be any conflicts, and little did we know that the governor would call a legislative session to begin on this day or yesterday. But anyway, that will lead in a little bit because our panel here today that I'm about to introduce is going to be talking about health care in the Delta, and the legislative session that the governor has called, of course, is about the Medicaid expansion and the private options. So we're going to talk a little about that today. First of all, let me go ahead and introduce our panel. First of all, we have my good friend from Marvel, Dr. Becky Hall. Becky, would you come on out? Dr. Hall is the Center Director for UAMS East, formerly the Delta AHEC. UAMS East is a 7-county health education outreach of the University of Arkansas for Medical Sciences. With offices in Helena, West Memphis, and Lake Village, UAMS East mission is to improve the health of the Delta people. Goals of the program include the recruitment and retention of healthcare professionals and the provision of community-based healthcare and education, focusing on prevention and wellness. Dr. Hall received her doctorate in leadership and policy studies from the University of Memphis, and she's been the Center Director for UAMS East for almost 25 years. She's currently an assistant professor in the UAMS College of Public Health, and she sits on the Arkansas State Board of Public Health. Among many, many other accomplishments of hers, which are too long to read, notably she was named Phillips County Citizen of the Year in 2003. And we're very pleased and honored to have Becky Hall with us today. Next, I'd like to introduce Dr. David Lupo. Dr. Lupo, if you would come out. Dr. Lupo is a Pine Bluff native. He is a local boy who has done well. He graduated from high school here in Pine Bluff, went to the University of Arkansas at Fayetteville, got a degree in chemistry, then went to UAMS, and in 1981 he received his Doctor of Medicine degree. Dr. Lupo has a private practice at the Pine Bluff Urology Associates since 1986, and he has served as Chief of Surgery and Chief of Credentials and Surgery Oversight Committee, and is currently the Chief of Staff of JRMC. We're very happy to have Dr. Lupo here with us today. Our other panelist, Al Sliger. Al, would you come out, please? Al is my friend and colleague from Clarendon. Al and I have been working together for a number of years. Al Sliger is the Executive Director of the Mid-Delta Health Systems Incorporated in Clarendon. Since 1994, the Community Health Centers in Clarendon serves a 5-county area in east central Arkansas and provides primary medical and dental services to approximately 4,500 patients in that locality, in the underserved area of east central Arkansas. Al is also currently serving as board chairman of the Community Health Centers of Arkansas organization, which together provide primary health care to over 200,000 Arkansans in the most rural and underserved areas of the state. We're very happy to have Al with us today. And Bo Ryle, would you come forward, please? Bo Ryle is the CEO of the Arkansas Hospital Association. He has been with the association since 2005, and he was named president in 2010. He holds a bachelor's degree from the University of Arkansas at Fayetteville and a master's degree in public administration from the University of Arkansas at Little Rock. Bo also served as the chief lobbyist at the state level for the Arkansas hospitals and was previously executive director of the Home Care Association of Arkansas. He currently serves as the chairman of the Healthcare Providers Forum, is a member of the Healthcare Industry Council of the Federal Reserve Bank of St. Louis, is an Arkansas Regional Organ Recovery Agency board member, and is a past president of the Arkansas Society of Association Executives. So we have an outstanding 5-star panel here today, and to start off, I want to give a disclaimer that I have no particular expertise in the healthcare area other than being fortunate enough to serve for a number of years as the chairman of the board as a volunteer of the Mid-Delta Health Clinic in Clarendon, where I've learned a lot about healthcare in eastern Arkansas. What we want to do here today on this panel is have an assessment of where we are today with healthcare in the Delta, talk about where we want to be and want to go with healthcare in the Delta, and then try to figure out how to get there with the tools that we have at our disposal. So let me start off by throwing a question to Dr. Hall. Dr. Hall, could you educate us a little bit on what is known as the Red County report?
Thank you, Raymond. It's a pleasure to be here, and I just thank you all for coming today. Many of you may have heard about the Red County report that was published by the Arkansas Department of Health several years ago. This is a report, when it came out, it just broke my heart. It showed that 17 counties in Arkansas, and most of them are located in the Delta, have a life expectancy of 10 years less than those in Northwest Arkansas. Many of you know that folks in the Delta have chronic disease, and these are the cause of so many people dying early. But I think this is unexcusable that the people, most of you that are sitting here, have a chance of dying 10 years before those in Northwest Arkansas. The leading causes of death in the Delta include heart disease, cancer, chronic lung disease, stroke, accidents, suicide, Alzheimer's, diabetes, and kidney disease. Actually, if the Delta counties were taken out of Arkansas, the health statistics in Arkansas would rise drastically. And to me, this is a travesty. The health of the community depends on many factors, including the environment, both built and environmental quality, social and economic factors, education system, jobs and industry, and these are all linked together. In the Delta, with a lower educational system and with lower incomes, this makes a serious situation even more serious. In Phillips County, where I'm from, we rank 75th in the state in health statistics. When you think about Arkansas being 48th in the nation, it really puts those of us in the Delta in a disadvantage. We're a medically underserved area in the Delta. There's one primary care physician for every 3,000 people, and one dentist for every 2,900, and one mental health worker for every 1,200. Phillips County is number 4th in the state in cardiovascular deaths. Smoking is high, even though that has improved drastically in the last 15 years. 40% are obese. 58% say they have no access to exercise facilities. And there's a huge percentage of births to teen mothers. And the strange thing about all this to me is that most of the chronic diseases and the conditions that I just spoke about are preventable. However, almost all the healthcare dollars are spent on primary care. So when you think about that, if we put more money into wellness and prevention activities and access to those kind of opportunities, we might be able to enjoy an additional 5 to 7 years of good health.
Thank you, Dr. Hall. I appreciate that. And I'd like to follow up on this topic, and I'd like to ask Dr. Lupo if he can expound on what's being done through his organizations and his leadership in the Delta to address these issues.
Well, I think that my perspective as being someone born and raised, practicing and living in the Delta, that certainly I've been in Pine Bluff 34 years. We recognize that the entire Delta is an underserved area for many services, but healthcare is a glaring underserved area. I believe that to attack this problem has to be attacked on different fronts. Certainly education is a key, just as Becky said, not only educating our patients to take some responsibility in their own health care, but also educating
member of our Community Health Centers Association. Each of those community health centers are actually owned and operated by volunteer board of directors in the communities. So it really enhances that input and feedback of what we do to take care of the patients in the Delta.
Very good. Thank you, Al. And last but not least on our panel is Bo Ryle. Bo, would you just start off by telling us something about the number of hospitals in the Delta? And I think we're trying to be multidisciplinary here, and we want to talk about economic impacts as well. And so I know there are a whole lot of people who work in the healthcare field in the Delta. Can you shed some light on those aspects?
Sure. Thank you, Raymond. As you said, I represent the Arkansas Hospital Association. Within our membership, there are 100 hospitals across the state, many of those located in the Delta, as you know, depending on your definition, from Piggott to Jonesboro to Helena, Forest City, Monticello, Warren, Lake Village. They're dotted Pine Bluff, all across the state of Arkansas. They're from the large regional medical centers like in Jonesboro, Helena, and Pine Bluff, to the more medium-sized hospitals in Forest City. And they're also the critical access hospitals, which critical access are the smallest of the small. They are less than 15 beds, and they're certainly hospitals that operate on a very thin margin. So they're dotted across the Delta, and certainly We want to see those hospitals survive and thrive. And all of those hospitals are known certainly as the healthcare hub in their communities, but we also like to think of them as economic development and jobs. Across the state of Arkansas, Arkansas hospitals provide 44,000 jobs directly in their community. So when you think about those hospitals in the Delta, you're thinking about thousands of jobs that are available. They're good jobs. They're the largest employers in those counties. So certainly we need to be working towards keeping the access to care open in those communities for health care, but also the jobs that they provide across the Delta.
Thank you, Bo. Let me follow up with that by asking you to talk a little bit about what's going on in Little Rock right now. I know you probably, and we appreciate your being here instead of being up there at the legislature, where I'm sure you feel like you're needed and are needed, but so they're talking about the private option and Medicaid expansion up in the legislature. Can you talk about that from the hospital perspective?
Well, certainly from the hospital perspective, and being an Arkansan and being a former resident of the Delta, I grew up in Lincoln County, a small town, Yorktown, and graduated from Star City High School, so the Delta is certainly important to me personally. My family still lives in Yorktown. So when you think about what's going on at the legislature right now, the program is entitled, the governor has proposed Arkansas Works, which is the program formerly known as the private option. So you're all familiar with the private option that was passed in 2013, which used the federal Medicaid expansion dollars to expand the Medicaid program to people with incomes 138% of the federal poverty level and below. So what's going on at the legislature right now is a reauthorization of the private option / Arkansas Works. The governor's proposal is now in the legislative special session, which started yesterday. The good thing about this week is the policy itself requires a majority vote of the legislature. So we expect to have the Arkansas Works enabling legislation to pass the legislature today and tomorrow, and for the special session to end tomorrow. So a great success. But where the rubber meets the road is next week, when the legislative fiscal session begins. So that's the session where the legislature appropriates the money for, in particular, the Medicaid program. So the Arkansas Constitution requires a 3/4 vote of the House and Senate to pass the Medicaid budget, which has the Arkansas Works funding within it. So as they always say, it's hard to get the legislature to agree on mom apple pie with a 3/4 vote. It's very difficult to get, and that's what makes this controversial, because the 3/4 vote is so difficult to get. So right now, I think you've read in the newspaper, there is a number. It requires 27 votes in the Senate. I think by most people's count, there are 9 to 10 senators who are against the Medicaid budget because they want to, in effect, kill the Arkansas Works program. So our hospitals, and we are, a lot of people, a lot of the healthcare community, a lot of the business community are lobbying the legislators, saying that we have to have Arkansas Works reauthorized. It means jobs, it means health insurance. When you think about how many people are on the private option / Arkansas Works now, 250,000 Arkansans are on this program. It has opened up access to care to people who have not had insurance in the past. They have not had health care available to them. They're now learning the process of the access points, the physicians that are available, hospitals that are available. So it has helped improve already the health of Arkansans tremendously. And when you think about the impact on hospitals, we all know that uninsured have a big impact on hospitals and their uncompensated care. So this last year, we estimated pretty closely that Arkansas hospitals provide $400 million in uncompensated care to people who are uninsured. But when we looked at comparing the last year of when there was not a private option in 2013 to after its passage in 2014, we saw in Arkansas the uncompensated care decrease $149 million. That means a lot to the hospitals across the state, but in particular in the Delta, where there is a high rate of the uninsured. Gallup poll issued last August showed that Arkansas leads the nation in the reduction of the number of uninsured. We went from about 22.5% to 9.5%. So we're leading the nation in something, and that's something we should be proud of. We should be working toward reauthorization of Arkansas Works. We should all be supporting the governor And in his endeavor here of trying to get this passed, it's going to take a large effort. There is that blockade in the House and the Senate, and it's going to take a lot to overcome that over the next couple of weeks. I've been through this argument, I guess if you will, this issue since before 2013. And I can tell you I've heard every argument against the Arkansas Works program and private option. I can say that all those arguments have been answered. It helps the citizens, it helps the hospitals, helps physicians. There's always that question of, well, how are we going to pay for it? Well, the Legislative Healthcare Reform Task Force hired an independent consultant, the Stephen Group, to come in and identify how much it was going to cost over the next 5 years to have the Arkansas Works program. The independent consultant showed that it pays for itself, and that's including the state match to the federal government of 5%, a net benefit to the state of Arkansas of $757 million. So throughout this process, they've answered every question, every concern. This program works, it's successful, it's helping Arkansas in so many ways as I outlined, and I certainly hope that you will contact your legislators and ask them to support Arkansas Works.
Thank you, Bo. I think we can see how effective a lobbyist he is.
Raymond?
Yes, sir.
If I could, just to interject and
Please.
to follow up on that, directly from the Delta. We're talking about the uninsured, being the largest primary care provider here in the Delta. From following up on 2014, we saw over 15,000 of our folks that were uninsured move to having health care coverage in this last year. And that means that's 15,000 folks that have been able to access preventive primary care, secondary if they hadn't been able to get diabetes taken care of or high blood pressure taken care of. They're now being able to access care and access care in a preventive mode that is hopefully going to extend that life cycle.
Good. Dr. Hall, comments?
Just that personally, we have seen many people now that are receiving care healthier. We have a diabetes education clinic at UMS East, and folks are coming in there more and are receiving the education and the care that they need. So it has been a huge boost for the local hospitals in our part of the Delta.
You want to finish it up, Dr. Lupo?
Well, I think one of the, as we were discussing before the panel began, I can remember years ago when you couldn't find a physician who would accept Medicaid. They just wouldn't take Medicaid. Now, everybody accepts Medicaid, and it's because of the private option. So it's not only, it's allowed a lot of patients access to health care immediately and locally. Actually, they're, if you will, they're being fought over now where before nobody wanted them. So I think it really is, it's critical. It would be devastating if it did not pass.
Thank you, Dr. Lupo, and thank you, panelists. We're going to have a few minutes now for questions. If anyone has questions out there, there's a microphone in the middle. Yes, ma'am. You go right ahead.
Yes, I'm Dr. Nancy Ryburn. I teach at CR College, Southeast Arkansas College, and I have a private practice. One of the things that I don't think has been addressed very effectively is mental health. Many of my students drop out each semester because they don't have access to mental health, and they have so many family problems, they have so many personal issues, and I'd like to know what we can do to recruit more mental health professionals to the Delta.
Dr. Lupo, you want to take that one?
Well, that's a little bit out of my wheelhouse, but I think that it goes back to my basic premise about recruiting any kind of physician to the Delta, and that is we have to grow our own. And the way to do that, I believe, is by forming alliances. Alliances with UAMS through the AHEC program, alliances through the new osteopath school. And by educating our residents in the Delta early on, for instance, we have what we call a MASH program at Jefferson. It's Medical Advocacy Services for Health, and that's for 10th, 11th, and 12th graders. we're trying to turn them on to a profession in the healthcare industry. We don't care if they become doctors, nurses, mental health workers, or whatever. We're just trying to get them interested in healthcare. And then if they take that and they run with it through college, then there are other aspects that the community can contribute to when they're completing their college education, and they decide, well, if they decided they wanted to try to be a physician, then there is the rural healthcare program, where there's two different types. Either the community can agree to put up that student's entire cost of medical school in return for a commitment to come back to that community for 4 years. Well, I mean, if somebody's born and raised in McGee and they plan to come back to McGee anyway, it's a no-brainer for them. The community pays for their education. There's another program where the community pays half and the state pays half. So I think expanding that program and developing it, whether it's for physicians or mental health workers or whatever, I think that would be beneficial. And the other thing is, you know, you can't base whether you're underserved or not just based on population. Pine Bluff, although we have 50,000 people, it's underserved in primary care. So I think that where I would move is educating and getting people involved and engaged in health professions early, and then take advantage of the opportunities that are there, and then use our AHEC and our medical schools to expand them.
Okay, thank you. Any other responses?
I just want to say that I think it's up to all of us to, as we try to recruit mental health professionals in, primary care doctors or whatever, to embrace people when they come to our community. It's kind of like recruiting for an industry. A lot of times when industries come into our local town, they go to the quick stop and they hear about how horrible the Delta is. I think we all need to take ownership of this problem and be ambassadors for our Delta region, whether it's locally at the barbershop, at the beauty shop, at the gas station, or if it's at a conference like this. There's a lot when physicians come in or health professionals come into an area that we can do. I've said before, we may need to set up a dating service where we try to set up a dating service for the young girls or men or women in the Delta to marry people outside the Delta to bring them in. But, you know, it might work. But we need to all be welcoming. We need to talk up the Delta and not be so negative when new people come in, whether it's an industry or a health professional, which is like bringing an industry in. I've also wondered before if there's a way we can do tax credits to do, whether it's a primary care physician or a mental health worker or whatever, setting up a new business in the Delta. There's some way that we could give them some sort of tax incentive. I don't know enough about that, but there's got to be some way we can get them in there.
Thank you. Very good comments.
Becky, your dating service does work. McGee is about to get a new family doctor that's graduating from our AHEC program, and his wife's a radiologist, so they're getting 2 for 1. And if you go through the small towns, I primarily am familiar with southeast Arkansas, but if you go through Lake Village, they have one family practice doc down there that is from our AHEC program. They have a general surgeon who did a lot of his senior rotations at Jefferson Hospital. He's in Lake Village. You know, McGee has the family practice doc that's going in July, plus his wife radiologist. Fordyce has one AHEC graduate who went in with her dad. All the 4 young family docs in Crossett are products of UAMS, and one of them is a product of AHEC and went back to practice with his dad. All the people in Warren, all the family docs in Warren are from Warren. That's why I said we have to grow our own, and we can grow our own, and we may have to provide some incentives like you're talking about, whether it be a tax incentive or community getting involved to get them there. But I think your dating service does work.
Excellent. Any other questions? If not, we'd like to thank you for, wait, we have one more question coming here. Yes, sir. Fire away.
Maputo Kalulu from UCA. Dr. Hall, you painted quite a gloomy picture about the health status of the Delta. And Dr. Lupo, you mentioned some interventions that are taking place. So I'm looking for a word of hope. Are we seeing any progress with those interventions?
Yeah, I think there's a lot of progress. A couple of years ago, the Arkansas Community Foundation did a report called the Aspire Report, and in it had maps outlining the health statistics all over Arkansas, and it was about people's access to exercise and obesity. And when I first saw Phillips County there, I thought it was darker color than the rest of the Delta around it, or a lighter color maybe, but anyway, I thought, oh no, we're even worse than we ever were, but we weren't. had improved more than some of the rest of the Delta with addressing the obesity issues. In Helena, we're fortunate to have a fitness center and a wellness center and weight loss programs and all that. Have a lot of people. We have over 2,500 members in Helena, plus all up and down the Delta exercise programs. So I think those are working. And I think if we can get the obesity under control, that the other chronic disease statistics will improve. As far as primary care physicians, I think that, as Dr. Lupo said, the AHEC program is doing an excellent job of placing those physicians in the rural areas and specifically the Delta. We've got more work to do, but I think slowly things are changing. One of the things that I also think is helping is the wonderful partnerships that we have developed. Melly Broadswell is here with Greater Delta Alliance for Health, and they are a formation of 10, I believe, rural hospitals that are putting together their resources and writing grants and getting money for programs like prescription assistance, and they're promoting the private option, and they're doing all sorts of other educational programs. Tri-County Rural Network in Helena that serves several counties in the Delta are doing great with getting information out. So I think the more people that are working together, the more good that is happening. And we are seeing improvement in a lot of the health statistics. Health statistics are hard to improve, but I think we're seeing that.
Thank you, Dr. Hall. Is there one more question? Okay, we're running way late on our time. We'll take one final question. Thank you.
Hello, my name is Attorney Johnny Miller Matlock. I'm from Marble, Arkansas. So, hello, Ms. Hall. I had two comments, really. One was that you said that more physicians are seeing Medicaid patients. I have had calls from people who say that they cannot find like neurologists or certain physicians to take them because they are Medicaid patients. So that's one of my comments. The other comment is that I have met two, here in Pine Bluff, two people that have finished medical school at UAMS. However, they were not able to match, so they're setting out a year. So I want to see if you all could give me comments on the people that still are on Medicaid and still cannot find physicians, and on people that have finished medical school were not able to match, that are homegrown from Arkansas, and are setting out here I know two that are setting here in Pine Bluff trying to get some practical experience, but they could not get into a residency program.
Al Sliger, would you handle that?
I would. Thank you for the comment and the question. And as far as the folks that have not been able to get in to see a physician, that's on Medicaid, a lot of that from our primary. That's one of the issues with our reimbursement mechanism that we currently have in the state, is that even though we had additional coverage through the private option, some of the reimbursement rates that are made available back through the Medicaid program to our private physicians, we're still inadequate, if you will, from a lot of our private insurance coverages. And so that has been a restricting factor for folks being able to open their doors to see all of the patients. And probably equally as much of an issue on that is just the shortage of physicians and as far as the coverage and being able to see patients, because it's been a great asset from the private option in having insurance coverage become available, but the flip side of that has been with all of it, it's created a significant increase in demand that our provider population has struggled to be able to meet just because the floodgates have opened, and now we've had that much more demand coming in, and it's really overloaded, especially a lot of our specialty areas of CT scans, urology, pieces of that nature, so that we didn't have a lot more specialists come out of UAMS and the supply to be able to take care of that demand. And so there's a real struggle in that from last year and moving right now at this point, being able to do that. And moving just from the supply aspect of that, we've talked a little bit about behavioral health and primary care. One of the other areas that I would just like to say is we're moving forward, and it's going to get into the specialty care also. But, you know, this touching base on the osteo school for the Delta, they have established their priorities to bring the providers back and create residents, hopefully, with our local providers that are already here, so that, and given precedence on folks that are coming to the osteo school, coming from the Delta, so that we know that the end of result of that is there's going to be an increased amount that is going to come back into the Delta.
Thank you,
So
Al.
hopefully that is going to increase that supply.
Good.
And one of the things that we haven't talked about a little bit that is really we need to encourage and has been encouraging, and as far as our primary care setting in the Delta, is the availability of nurse practitioners, physician's assistants, the mid-levels, UCA, the psychology program at UCA, that is now allowing us to, from a primary and preventive standpoint, open the door as far as access to our folks that we technically, you know, could not do if we did not have those programs that they have established here in the last decade.
Good points. Thank you, Al. Thank you, panel. Thank you, questioners. Good questions. Good panel. Let's give a big hand to our panelists here. Excellent.